Okay, good evening, everybody. My name is Nadine Grainig, Goatsi Hiname Suchietza. I'm a member of the Pueblo of Laguna in New Mexico, and welcome back to our Indigenous Perspectives series. We took a little time off this summer, but we're back, and I'm excited. We're starting out with a really great topic. That's traditional knowledge in health and wellness. So we've got a couple of really great panelists here. I'm sure you're going to learn a lot from them. I expect to learn a lot from them as well. Just a little background, Save Our Schools Arizona Network is sponsoring this series, and Save Our Schools is about saving our public schools. And the main goal is to keep tax dollars in our public schools and to fight the public school money going to private schools through a voucher system. And we've had hundreds of millions of dollars being funneled out of our public schools into private schools. There are a lot of issues with that. So that's our main goal, but we're also here to support students and public schools in every way we can. And of course, that relates to health and well-being as well. So again, I'm really excited to have our panelists here. My background, if you don't know it, is I was the Director of Indian Education for the Arizona Department of Education. And I worked for the department for almost 18 years. I also ran a nonprofit organization, and I currently run a small business called Sun Clan Consulting. So that's a little bit about me. And Sun Clan is my clan through Laguna. So I'm going to introduce our panelists and let them say a little bit about themselves as well after I'm done reading their short bios. So our first panelist is Lana Rodriguez. She is the Executive Director and founder of Body and Soul Sovereignty United. It's a new nonprofit organization. So Dr. Rodriguez is a certified nurse midwife with over 30 years experience in the public, private, and federal sectors. She is actively engaged in culturally sensitive and trauma-informed care practices to support resilience in women of color affected by historical and societal oppression and trauma, with a special focus on the health issues of Native women. Dr. Rodriguez has been certified as an ACE trainer, that's Adverse Childhood Experience trainer, art math trainer, and a certified clinical trauma professional to provide guidance for clinicians and community partners in translating the ACE's foundational research into trauma-sensitive practice. Her vision is to help destigmatize the effects of trauma, support self-determination in the health of Native women, and break the cycle of transgenerational trauma on future generations. So welcome, Dr. Rodriguez.
Thank you, Nadine. It's good to be here with everyone.
Well, we're glad to have you. So our other panelist is Federica Hunter. And I'm going to say this in English, and you can say the name of your tribe so it's pronounced correctly when I get to you. So Federica Hunter is a member of the Blackfeet tribe of Montana. She received her bachelor's degree in health and human performance from the University of Montana and her master's degree in social work from the University of Utah. Federica has devoted her career to serving Native Americans in the areas of suicide prevention, higher education, foster care, community development, and women and infant wellness. So welcome, Federica.
Thank you. So the name is Amsaki Pakani. That just means Blackfeet. I'm a member of the tribe. I thank you for the introduction. My background, I have a licensed clinical social worker, and all my work has been in Indian countries in various different capacities. So I'm anxious to be here, and I hope I can contribute to the conversation.
I'm sure you can. So thank you for being here. So Luana, do you want to say a little bit more about yourself?
Let's see, you pretty much mentioned everything. Anything else is...
We didn't say where you were from, right? So.
Oh, well, I am from the Bronx, New York. I was, back in high school, I had wanted to come over to the Southwest and work with Native women. I am from a family of healthcare providers. In fact, my closest sister is a nurse. And I've just always wanted to come this way because I also knew about the Indian Health Service and how challenged they were in terms of staffing, hiring staff and retaining them. and the health disparities that were going on with Native women. So that drew me to this side of the country.
That's interesting. All the way from New York, you learned about what's happening here.
Yes.
Yeah, well, we're glad you came. So I'm going to go ahead and start with our questions here, and just you mentioned a little bit of an answer to this question, but I just wanted to know what compelled each of you to get involved in healthcare, especially for Indigenous women. So, Frederica, you want to go first?
Sure. You know, it's kind of interesting how our paths lead us exactly where you're supposed to be. My whole dream was to be a health educator, right? And but all the paths open to social work, and I was able to get my licensure. So it's kind of ironic that my work has taken me into the healthcare field. Just most recently, I was a licensed clinical social worker for the OBGYN at the Phoenix Medical Center. In other capacities, not directly involved with healthcare, but affected by healthcare as a female Native American woman.
Okay,
So
great.
being able to speak to the disparities and the challenges is something I'm very passionate about.
Right, and we need people like you with passion. So you reminded me of my father had twin sisters, and they both became surgical nurses. But when I was a kid, I used to faint at the sight of the needle before it even got to me. So that was out of the question, was healthcare provider for me.
I do want to say it's kind of interesting because both my daughters are nurses, and one of them is a labor and delivery nurse, and the other is a maternal health nurse. And so indirectly, I have my children doing this work for us as well. So.
So it's a family thing, kind of like Lana was saying, you have family health providers also. So, so what compelled you, other than what you've already told us about understanding that there were health issues with our Indian Health Service?
Well, in terms of me getting into the healthcare field, I
And
knew
specific to Indigenous women or people as well. Yeah.
Yeah. But initially I felt, okay, it's either midwifery or veterinary medicine. Those are the two options. And then when I decided midwifery, then I started to really research more about how I was going to do this and where I was going to practice.
Okay, great. So for those of our audience who may not be aware, would you please describe the difference between, from your perspective, between Western medicine and traditional Indigenous medicine?
Well, I can start. I can talk about the Western view of health, and maybe Freddie would be able to elaborate on the traditional Indigenous. So the Western view is kind of like a ladder. It's a hierarchy of living beings with man as superior. So in healthcare, that basically means that it's a male doctor. Men have been in obstetrics for a long time. So it's always like a male doctor that's at the top of the hierarchy, and who we are to acknowledge, to respect, to accept his word as the final solution to all health issues. Also, the goal of treatment within Western medicine focuses on the individual body parts of specific conditions. It doesn't encompass the whole. That's Western.
Okay. Very good. That's very easy to understand. Thank you. So Frederica, how does that compare with traditional medicine?
Well, with traditional medicine, I think they take the entire person, the mind, body, soul, and spirit into consideration. And I think they look at the individual as a whole, and knowing that each domain needs to be in balance. If you're not in balance in one area, let's say you're a very spiritual person, but you're lacking, you're physically lacking, you've got physical ailments, or maybe mentally you're not doing very well. So the Indigenous perspective really takes the entire person into consideration. And I just want to share a real quick story. My son has autoimmune disease, and he was referred to he was to more like a naturopathic by a naturopath to the specific doctor. And what he learned, it was really amazing. He was saying, Mom, you know, when you go to a doctor, they just take a look at you. He said, but this particular person asked me questions, and most importantly, he asked me about my spiritual and encouraged me to really take a look at that as well. So he did an assessment, and he was a naturopath, but he also, along the lines of Indigenous teachings, he took that into consideration. And so what he took away from that was he was so excited about the fact that they addressed the spiritual, his spiritual realm, and encouraged him to treat each part of his body, soul, spirit, mind. So
Yeah, so it's more about balance,
it's
right?
more about yeah.
So achieving that balance with nature, with yourself, with the creator, all of that is taken into consideration. Right?
Mhm.
Yeah, so it sounds very compartmentalized in Western medicine. Do you see that there have been any influences of traditional into Western medicine that's getting any headway, or you know that non-Native people might physicians or other healthcare providers might be now incorporating or buying into? Either of you can answer that.
Yeah. I'm starting to see it, but not to the degree that we would like to see it. But it's starting.
Okay, well, you got to start somewhere, right?
Yeah.
Frederica, have you seen that?
I do. I think, like I said, I'm from Montana, but I do know that some of the, IHS is very limited as to what they can do. But I do know that some of the tribes that are maybe that are not under, well, maybe they are, some of them are. For instance, there's in the hospital up in, I think it's in South Dakota, they have brought in like a rope for the women when they're giving birth, because the gravity just naturally goes down, and historically that's how women gave birth, is they gave birth standing up and not laying down. And so they really want to incorporate that into their delivery. And so I think slowly but surely, and I think that each tribe is different, but
Sure.
I was really happy to hear that, because what it did is really took into consideration the culture of the Native people.
Yeah, I was never able to get pregnant. I had endometriosis, so I've never given birth. But I would just imagine that, yeah, having gravity help with that would be great. But also, I would think it'd take less pressure or put less pressure on your back too.
Yeah.
And maybe not have to push so much. I don't know. I've seen live birth. My sister allowed me to see one of her children being born, and my niece as well, saw her child being born. So I'm assuming this is why you started your nonprofit organization, the Body and Soul Sovereignty United, is because you see there's a gap or there's a need to work with our Native people and incorporate more traditional ways. So can you tell me what your mission and vision are for this new organization?
Sure, Nadine. The mission is to provide Native women with access to all-inclusive, evidence-based maternal women's health knowledge while promoting improved client-provider relationships. So it's about addressing the lack of access to care by involving the women to pursue their own health knowledge, to be able to navigate the Western conventional healthcare system, and to make informed decisions to improve their health and the cost of healthcare. It also includes having the providers learn about implicit bias, culture, and trauma-informed care so that their knowledge of relationships can improve. The vision is to empower Native women to reach for the highest potential of maternal and women's health and break the barrier of healthcare inequality.
Yeah, great. So you mentioned that, in Western health, it's usually male dominated. Most doctors or OBGYNs are male. So do you work with any male doctors to educate them, or do you mainly work with women?
Well, more women are coming into the field now, so I do work well with both. I, set a certain demeanor with them. I'm more of a feminist too, so I have my opinions about about certain things. I still don't believe men should be in women's health, but that's my personal opinion. But yeah, it's coming to fruition. I mean, there's more women coming into the field now, so that's a good thing.
Yeah, and I was thinking about that earlier, that there are more Indigenous doctors and nurses coming into healthcare. So that might also, I would imagine, would help blend and eventually maybe get a mixed approach. Obviously, modern medicine and science mixed with tradition. So can you tell us what prompted that? I know I've started a nonprofit, which I told you in 2007, no longer with it, but I ran it for 11 years. And I had passion about educating our Native American students that they weren't getting what they needed. And so that's what drove me to start a nonprofit. So usually there's an incident or something, an epiphany, something comes to you that makes you decide to start a nonprofit, and the passion carries you forward. So was there an occurrence, an incident or something that happened, a circumstance that got you started down that path?
Yes, definitely. Do you want to speak, Federica, or would you like me to speak?
I'll let you speak, and then I'll go ahead and tag on you. Yeah.
So in the latter part of 2020, I'd say around November, there was a sudden closure of PIMC's labor unit. And we saw the adverse impact that it had on the women. It was like a negative rippling effect that had affected the women and families. In fact, I had one of the nurses at PIMC told me when she was speaking to one of the women who was close to her due date and told that she could not deliver at PIMC. She said to the nurse, "If I had known this, I wouldn't have invested my money in building my baby's nursery." And that hit close to home to me. It broke my heart.
Yeah.
So yes, it was the sudden closure of the unit that did this. It was done suddenly without any planning, especially with regard to how they're going to handle the women, where they're going to send the women, how they're going to talk to the women about it, how are they going to manage the finances. The women were met with huge hospital bills going to other hospitals. So it was horrible, I have to say.
And this it just before COVID really hit us hard too, right?
Yes.
Yeah, I can't imagine how terrifying actually that would be, from lots of different perspectives, like you said, financial and emotional, and yes. Frederica, what did you see when this happened?
Well, being the social worker for the OB unit, it did come as a surprise and shock to our women, and they were devastated. I mean, they weren't afforded the opportunity to even plan. And for us, that's really important, being able to plan and going down this road where you feel like everything's okay. And then the last visit is your last visit, and not knowing where to go, whether or not your delivery is going to be covered. And if you weren't covered by Medicaid, not Medicaid in Montana, but Access here, that potentially meant, hundreds and thousands of dollars of money that, as you know, our population doesn't have that kind of money. And so put a huge burden on our women. And instead of being able to enjoy the rest of their birth, or the rest of their pregnancy, they were worried about, okay, how do I cover this? And what's going to happen? And so it was very devastating to watch these women and try to support them the best we could. And like I said, it was devastating to witness. And out of that, I don't know. I mean, I don't know whether or not PIMC will continue to provide labor and delivery services, but I can guarantee you it's a much needed service that our community depends upon. So we'll see, but it was definitely devastating, not only to watch our women really suffer and be traumatized, because it was traumatizing for them.
Sure.
But feeling like our hands were tied, not really being able to help them in a way that we can help them navigate. And I think this is where Lawana's passion came through and said, gosh, we got to do something. We have to do something, you know. And a lot of our women, you know, we don't challenge authority a lot of times. We won't, you know, we don't push back. And so instead of demanding answers, a lot of them just accepted it for what it was and just dealt with it, you know. And so that was really, really, really difficult.
I would
And it's-
imagine that, oh, I'm sorry, go ahead.
You know, as a mother myself, you know, I can't imagine what these women, I can imagine what they went through. So, yeah.
Yeah, and I was going to say that obviously, I don't know how many women this impacted, but there had to be some that maybe were having difficult pregnancies or pregnant for the first time. Stress is not good, obviously, for a pregnant woman, and this had to heighten the stress tremendously for so many of them. So Phoenix Indian Medical Center, I take it, is not run by Indigenous people. Is that correct, Lana?
Well, you have Indigenous in administration and the staffing, but they have the commission core. Okay, so this is a non-combatant group of individuals, federal employees, and most of them are not Indigenous. They seem to be running the show. And it's unfortunate because they're running it in such a way that it's full-blown Western medicine, full-blown colonialism. It's alive and well at PIMC with the Commission Corps.
So they're not catering to their client, basically, right? They're ignoring the needs of many of their clients, I would imagine, who are more traditional.
They have a system of, how can I put it? They have certain goals for their employees, that these goals have to be reached by a certain time. And if not, then, you know, they get demoted. I don't know what exactly what it is, but the whole focus is on them achieving a certain level within the organization. All right, so I don't think they have the best in mind for the Indigenous community. And I'm probably going to get slack for saying this, but
I might too, I don't know, but
Slapped, I get slapped. I witnessed that, and it was very disheartening because the people in power were Commission Corps individuals, and we did, you know, I think at the time this closed, we did have an Indigenous CEO that took the recommendations of these individuals and closed it. And so Commission Corps is very powerful within IHS.
so is that an official name or determination for this group of people, or is that just what they're called, Commission Corps? Is that
Commission Corps? Yeah, they dress in military uniforms, but they're supposedly non-combatant.
Yeah.
But just their presentation is very threatening.
so it's CORPS, not CORE?
No, CORPS.
Okay, so yeah, when you said they're military, okay. Commission
My
Corps.
husband made a comment. He said, how can true healing happen in a military setting? It's kind of interesting.
Yeah. Healing typically has to happen after being in a military setting. Okay. So have they reopened the unit, to your knowledge, since then?
Not as of yet. Not as of yet. I do know that PIMC has hired a new CEO, just assigned in August. His name is James Driving Hawk from the Rosebud Sioux Tribe. And he definitely wants to reopen the labor union. That's the sense I get. So in the
I
meantime,
believe I know his wife.
I'm sorry.
I believe I know his wife.
Oh, yes, really?
Yeah, I'll have to talk to her and ask her, get the inside scoop if that's his name. I don't know his first name, but she has
Yeah,
the same.
it's
Anyway,
actually in the Indian Country Today
okay.
website. Yeah, they mentioned it. So, but the
Okay.
women are still being cared for at Valley White Hospital, as far as I know.
So I know of Native Health. Do they have services for OBGYN services?
Yeah, they have, they provide prenatal care, but I don't think they're affiliated with a hospital. Do you know, Frederica?
I think there are hospitals that they work with, that they refer to. So if they get their care through, and I may be wrong, but the way I understood it was that they can receive their prenatal care, but they were also referred to a specific hospital that Native Health may have had a connection to. So that's the way I understood it.
Okay, thank you. I appreciate learning about this situation a little bit more. So let's switch gears a little bit. As I indicated before, Save Our Schools Arizona Network sponsors this series. And we do talk about a lot of different subjects because there are a lot of different needs among Indigenous people. And so, especially students. So we work to inform our audience about all issues regarding Indigenous people, students and communities, families, etc. So, and I know you're a new organization, Audience All is a new organization, but do you have plans to, or maybe you've already started working with schools, public schools, maybe school nurses or counselors or anybody who's interested in, the health and well-being of our Native students?
Mhm. Well, we're not working with schools yet, but it is on our agenda. So any organization that cares for Native women and children will need training on implicit bias, cultural sensitivity, and trauma-informed care. All of these are connected and go hand in hand. You can't educate on one topic without including the others.
Our legislature might say differently, but I
Right.
agree with you. So, yeah. Okay, that's great. And that's something, Sun Clan Consulting and of course Save Our Schools Arizona. We work with all public schools. I didn't say this earlier, but I am the Native American Outreach Coordinator for Save Our Schools. So I can definitely help you with that, connecting you to all the public schools with high enrollment of Native American students. So we can talk offline about that.
Okay, sounds good.
Yeah, work together. So Frederica, when that begins, what are the kinds of things that, generally speaking, because like you said, all tribes are different. A lot of people don't know that. I've heard people say, ask, do you speak Indian? As if there's only one language among over 560 tribes in the country. It's like, no, we're all different. We're all unique. Um, I know that Luana just mentioned implicit bias and just, historical trauma, things like that impact our kids, misconceptions. Is there a way that schools can address those biases and misconceptions and lack of good healthcare practices early enough for future mothers to ensure better outcomes for their pregnancies and for their infants once they come into the world?
Definitely, I just want to kind of back up just a little bit. A lot of my work has been in schools, and it's kind of interesting. Before I came to PIMC, I was the director of American Indian Student Services at the University of Montana. So I was working with all the tribes of Montana, and so I was able to see all the students that came through and provide that support. One of the things I know. And I don't know if I'm answering your question or not, but what I saw was a lot of our students had a hard time learning how to self-advocate for themselves, to learn to be their own self navigator and advocate advocate for their education. And so I think there's things that we can do within the schools that can help our young people for leadership. There's leadership that we possibly, I mean, you're probably offering that as well, leadership. I think even simple things as, again, I worked in Indian country and we did life skills. And, you know, when you think about life skills, it is self-advocacy. It's learning the simple skills in life that will help get us, you know, help navigate life. And I think there are things like that we could possibly do that would help educate. I think there's a lot, but I've been able to get into the schools and maybe assessing what the need is, and also how we could best be of support in helping these young individuals. But generally speaking, you know, I'm a graduate of boarding school. I went to the largest boarding school in the United States, Intermountain. A lot of people don't even know about that school, but I can tell you, in my generation, I was not encouraged to go to school. In fact, I was discouraged from higher education. And so we have a lot of first generation individuals who will be breaking ground for the first time and going into higher education. This young generation that we're talking about, and just learning how to navigate that system in itself. But I was part of a generation where we still were expected to do vocational skills, you know, and so we see more and more of our Native people breaking into higher education. We have doctors, lawyers, nurse practitioners in midwives, and so that in itself is really good to see. But I can tell you, and it's not that long ago that I was thinking back about that, but we weren't given really any support to be other than a kitchen helper, or, you know, a cosmetologist, or a seamstress, you know, anything vocational. And
Right.
so, and that wasn't that long ago. I mean, yes, I'm older, but that was only a couple of years ago. And, you know, we still have those individuals who don't really understand or know how to navigate that, you know, even thinking about going on to higher education, or what that even looks like, or what that might, you know, what that might bring for them.
Right, exactly. And that is something that Sunkland works to help our Native students, just to realize that all the options that are out there, you know. And through my work for the Department of Education and through the nonprofit organization, we expose Native youth to people in various careers, whether it required a college education, vocational training, or not, you know, whatever it required. If that's what they wanted to do and be, we would help them to achieve that. But mainly just to give them examples of Native people who are doing things like being a doctor, a dentist, a nurse, but we also had engineers and artists and musicians and entrepreneurs, and, you know, many, many examples of different things that they could do that they wouldn't be aware of otherwise if they didn't come to our events or we didn't come to them, you know, to teach them about that. So a lot of what we try to do is prevention, to avoid having to do intervention. So that's kind of what the question was related to, is preparing children early to look at their health and well-being, what they put into their bodies, how that affects them, you know, for good or for bad. So yeah, that's what I was interested in, is do you have plans, you know, for doing that? And very, very happy, like I said before, to partner with you, your organization, to make that happen.
Good.
So for someone going into the healthcare field, so some of our young people who might be listening to this, or their parents might want to encourage them to go into the healthcare field, and they're unfamiliar with traditional ways of healing, what would your advice be to them to become familiar? Where can they go to get the kind of information that they need?
Well, I think the first thing they need to do is learn the foundational components of cultural competence, and it tends to be best from authoritative agencies. There's one called it's a long name. It's the National Standards for Cultural and Linguistically Appropriate Services, NCLADS.
Wow. I thought the name I gave my nonprofit was long. So
So that's first of all. And secondly, I think just getting involved in the community, learning from the people themselves as your informants. There are many tribes and always cultures within cultures. So you have to ask each individual what their cultural perspective is and learn from them.
right, and
I
there
agree.
are fewer elders around to actually listen, and fewer medicine people around too. Federica, would you agree with that?
I agree with you 100%. And I think that, and I agree with Luana, I think that's really important, being part of the community and learning about individuals. And we have people that come from very traditional backgrounds, and then we have people who have been raised urban, and so sometimes they're not always in touch with their indigenous ways, but they want to, but they have nowhere to go. And like you said, the elders, we don't have as many elders these days that are able to really pass down those cultural ways and traditional ways.
Yeah, so we have to find a way to tap into those before we lose it completely.
Right.
And I know that our languages are being lost fairly frequently already. And of course, language and culture are interwoven. You can't
Yes.
really have one without the other very well. And my mother was a product of boarding school as well, so I know. Were you taken from your family forcibly,
No,
like they did my mother?
yeah, no, I wasn't. It was by choice. It was by choice. My stepfather was in the military, and he was very, very strict and very military. And so that was really difficult where we came from, we came straight from the reservation, and then we moved to base in Washington. And it was just a huge cultural shift for me. And I missed, I missed being around familiar faces that with the same skin
Sure.
color. So and my mom went to boarding school as well. So when I approached her and told her I really wanted to go, she was not in favor of me going. But I can tell you, going to boarding school, and not a lot of people agree with this, but it was the best experience of my life at that time, because I got a chance to learn about all the different tribes across the United States outside of Montana, to learn about the Laguna, Pueblo, the different Apaches, White Mountain, Mescalero, Jicarilla, the Alaskan Natives. So it was really a great learning experience. And at that time, we were really encouraged to share our culture with one another. And so for me, it was a good experience. And I also, one lesson I learned is that I took responsibility for my own actions. I couldn't blame anybody on anything that I did. My actions were my actions. And so if I did wrong, I suffered the consequences. And so it was a good experience for me. Not everybody's experience was, the best, and I acknowledge that. So it was good in that sense, but bad in the sense that I didn't get the best of education either. I made honor roll with C's. I'm like, how the heck did I do that?
Yeah,
You know what I'm saying?
the bar was not set high.
The bar was not set high. So it was a challenge to be, to get through school, because you're learning just basic writing and math. And that was very challenging. And it was very embarrassing as well, but you have to be resilient and push through and swallow your pride and be a little humble. So it was a good experience in that regard. So.
Yeah, well, and the reason I mentioned that my mom went to boarding school is because she did not have that good experience. She had the one that may hear about more often than good experiences, because she was punished for speaking her language, and Yeah, she was told, she, and of course everybody else, she went there, I think primarily it was Santa Fe to St. Catherine's boarding school. And I believe she was there with a majority of Pueblos. I don't know that there were other tribes there. She didn't mention them, represented at the school. But anyway, they were told not to speak their language, not to teach their children their language. And so I have a disadvantage there because I don't know Laguna. I introduced myself at the beginning. I know how to do some things and say some things, in Laguna, and understand some phrases. But for me, I don't have a language barrier when I go in to talk to somebody about my health, to a health practitioner. But there are people who do. There are older people who are very traditional, who don't leave, their homes very much, or their reservations. So what happens in that situation where you have a health practitioner who doesn't speak that language and there's nobody around to translate necessarily? How do you handle that?
Luana,
Well,
yeah. That.
Yeah, well, I was gonna say at PIMC, the way they did it, they have this blue phone that they engage that has a translator at the other end, and they just use it. And with me, since I speak Spanish, they would just pull me in, and I should have started charging for that, but but they're supposed to use a professional translator through the blue phone. Mhm.
Yeah.
Using that phone, it was so impersonal because you could not, you had to be, you were not able to really converse with the individual. You might be able to ask one question, but they were not able to really converse with you so you could really get to know the individual. So it was very challenging in that way. So if I had to go see a patient that was from Mexico, Tohonatham or Pasquayaki, mainly the Pasquayaki, it was very challenging because I could not, it felt so impersonal. And I'm one of these people that, being able to read the individual and be able to really have a conversation, it was very limiting. And so you got basic information, but you weren't able to get to know the whole person.
So I'd imagine that would be very difficult to treat the person. So did you find that? Are there cases that maybe you followed to see what kind, or studies that have been done to see what detrimental impact that would have in providing good health care?
Never thought
No,
of that. No, we should.
we should though. Definitely should. Yeah.
Definitely.
I know it's difficult to come across research-based, evidence-based programs or data information that results from good programs in education for Native American students. So I'd imagine it's the same for healthcare and other aspects of Native life. But yeah, it needs to be done, especially when you go after grants. As a nonprofit organization, I'm sure you're going to have to, or at least consider going after grant funding to help you move your mission along and achieve your vision. They like to see that what you do is based on evidence of something working. But when you're doing something that's unique and different, nobody's done before, it's kind of like that high school student trying to get a job, but they can't get a job because they never had a job. So they don't have that experience. So sometimes you have to do your own research. And whoops, just flipped my pen, excuse me. So we have about 17 minutes left, and we were planning for a two-part session, which we can still do. We can think of some other questions. I do have more questions for you here. I wanted to get through them all, but I'm not sure we can do it in 16 minutes now. And hopefully people will listen to the recording of this and they'll have their own questions. So, but I'll just keep on moving forward and we'll see how far we get, okay? Is that all right?
Sounds good.
Okay, so kind of changing tracks again a little bit to kind of the political realm. We kind of touched on that a little bit with the Phoenix Indian Medical Center situation, but I, of course, am more familiar with the educational legislation that affects our Native students and students in general in Arizona, and some of the decisions that have been made in this last legislative session and ones prior to that. So in 2019, for example, this is not education per se, but it definitely impacts our Native community. House Bill 2570 was introduced and passed in the 19 Arizona legislative session. And that legislation is to address the many missing and murdered Indigenous women and children. Do you see any need for legislation to support the kind of work that you're doing?
Oh, definitely. But I say it's more of a social justice issue. And I have yet to see any bill that supports the empowerment of women to take charge, even if it's only for benign issues such as education. So I don't know how far we can get with this issue in the legislature, which is part of the access to care, especially if it's being addressed from a feministic viewpoint, and because of the negative connotation feminism has been associated with. But yeah, we have to try to work towards that. It's going to be a challenge.
It always is, yes. You're to go against the system or what's already been established. So, Federica, from your point of view as an Indigenous woman,
I
do
was
you
sitting
think,
here,
is there any, oh, I'm sorry, go ahead.
no, I was sitting here thinking about your question, and I was thinking about what's really been interesting, watching across Indian country, how many Indian people are in our state legislators. And so I don't remember seeing that many, but as I was watching Montana and watching other states as women are getting into positions of power and voice, and they face their own challenges. I can tell you that they face their own challenges, but just knowing that there are individuals who are paving the way. I'm hopeful that we could eventually get to a place where we can, we can have a House bill proposed and supported. That's my hope. But yeah, just looking at the political realm, it's really interesting and really delightful to see more Native people in state legislature, and they're being in their
Definitely,
state.
they're mostly women. and
thank you for that. Yes, mostly women.
In Arizona, I think we have 4 or 5 female Indigenous legislators, and of course, there's Deb Holland from Laguna Pueblo, my tribal sister, who's the Secretary of Interior. I mean, that's an amazing accomplishment, and such a role model. Of course, we have other Indigenous legislators at the federal level too. Mm-hmm. So yeah, now things are happening, and so that now's the time to really get on that train and keep things moving forward. I have a comment here from a listener. It says from Elizabeth Johnson, whom I know. She says, esteemed speakers, thank you for your mighty call to make transformative changes in the healthcare for Indigenous women. Tomorrow, I will stand in front of 75 pre-service teachers, of which 80% are white, middle upper middle class, and frighteningly westernized. I too stand strong for zealous equity and unapologetic inclusion. It is so challenging in one semester to help them unpack their privileged backpacks. I would love your advice and thinking on how to move them more quickly, given the tragic hate that has infested our country. And that might take us into part 2. That's a big question.
Oh my goodness, yes.
Dr. Johnson is an educator. She's a professor at Eastern Michigan University. So she works with pre-service teachers in the College of Education there. So some little background on her. She's also one of our consultants for SunClan.
Yeah. I don't know how to respond to that. I think that in itself is a whole discussion that we could probably part 2. But I think, and I'm only being a minority person, it's really difficult to be to carry, how do I say it? It's really difficult to be in situations where you're the lone voice and trying to help people understand that passion and where you're coming from. There has to be a willingness for individuals to learn and to listen and be humble. And we are in this place right now where I've never seen this before, where people are, where our country is very scary. And so trying to move people along can be very challenging. And so I look forward to that discussion. That would be good.
Yeah, I definitely know what you're talking about. I suffered from that at the Arizona Department of Education, trying to get people to hear me and listen to me, and being as patient as I could for as long as I could until I couldn't be anymore. But yeah.
That was my experience too as a director of American Indian Student Services. I begin to say it was a token position where you're highly visible, but you're invisible. You're visible when we're having a grand opening, you're the front face, and but your voice was not heard or recognized, and so that in itself was a little traumatizing, and it's very difficult, so I hear you, Nadine. And
I hear you too. Sing it, sister. No. When I took over and I started kind of marketing the Office of Indian Education, so to speak, letting people know what we were doing and who we were. Even people within the department said, I never knew we had an Office of Indian Education. And I didn't start it. It started many years before that. But it was so it was just what you said, just kind of, there was a face to it, and that was about it. My problem was I tried to do something with it.
I do. Yes, I sure did. But
okay, so Beth, we will give our panelists time to mull over your question, and we have a week before part 2, so I'm going to go ahead and maybe ask one more question here. Yeah, we have time for 1 or 2 more questions here. So if you don't mind, Beth, we will definitely address your question in part 2. Okay, so what are your biggest concerns about healthcare for Indigenous people? What are the things that rise to the top that really need to be addressed more urgently than other things?
the first thing that pops in my mind is the access, access to healthcare. I can speak, like I told you, my son has an autoimmune disease that needs to be followed. He needs a primary provider. He has Medi-Cal, which is like Access of Arizona. I can tell you, watching him and his process, getting access to care has been challenging, and getting somebody to follow his care, because he needs routine blood work, he needs routine screenings, and that's just not happening. And he finally, after a year and a half, was able to switch over and get the care I'm hoping that he needs. But just watching him struggle in just accessing quality healthcare, and I think that would be across the board. And I don't know what your thoughts are, Luana, but that's the first thing that jumps out to me.
So can I ask a question real quick? Do you live in an urban setting or on a reservation? And
I live in an urban setting. He's living in an urban setting.
Still has trouble getting access.
Nope. He utilized I think there's like in California, in Los Angeles, they have like a Indian health clinic where he was able to be seen, but getting referred on, and even getting the medication that he needs, they would not cover it. They would not cover it. So he was coming all the way from California to be seen at PIMC, just so he can get the medication that he so deserved, and not just
Wow.
deserved, definitely needed to survive. So that's just my experience, but Luana, I'm not sure what your thoughts are.
Well, my biggest concern is that Native women are not provided with the full gamut of healthcare options that they deserve, and that they don't realize how powerful they can be by themselves and united to make change in the course of their healthcare. We have to empower these women. We have to make them understand that, you know, it's okay to shy away when you're not comfortable, but it's also okay to join and have a more powerful voice in the way you think you need your health care. It's all about your needs, not anyone else's. So that's my opinion.
Yeah, that sounds a lot like what we're trying to do in terms of empowering our Native families with information to be able to advocate for their children to get the services that they need. But they do need to understand that there's power in numbers, that they have power if they speak up. But so many of our Indigenous women are intimidated by the system, by the school system, especially if they had bad experiences at school. They don't want to relive those experiences and go in and, you know, be mistreated, or ignored, or whatever, you know, adverse kind of experience they expect to have. So we work with them to provide training, to empower them, to let them know about the different federal programs that are available for their children if they qualify, what kind of funding is there, you know, to meet their children's needs. So then together, because we don't do it one-on-one, we do it in groups. And as I mentioned, the Indian education committees, I think I did that offline before we got onto live on Facebook, is there Johnston O'Malley and Title VI are federal education programs that are there for Indigenous students. And each one of them requires an Indian education committee who makes decisions as to how the funding is to be used to support the children in the school or the district that's receiving the funds. And so we train them as whole groups so that they understand what's available. And then if they have children, or they know of children who have certain needs that aren't being met by the district, but they feel like they should be eligible for them, then they can go and they can advocate and say, I know about this funding. And not just the two I mentioned for Indian education, because there's funding there as well for students who are eligible for Title I funding, Title III, you know, different entitlements that come from the federal government. And so they need to know that that there's other funding besides Johnston O'Malley and Title VI funding for them, for their kids. And anyway, so that's how we do it. So I can imagine that it could work similarly for you, helping your future or current constituents, or clients, patients, to get more knowledgeable so that they can advocate for themselves as well. So that's why I think it's so important to get this information that you have to share into the schools at a young age, so it's already on the minds of the students that, hey, I need to take care of myself, or this might happen, or I might have to deal with that, or whatever. So I want you guys to do most of the talking, but right now I'm doing most of it. But any comments on that?
Yeah,
No,
good stuff.
Listening to you, because there are some parallels there, you know, with what our work and what you're doing. There are parallels there, but do you mind if I just kind of circle back really quick before we close off?
I've got 2 minutes.
Okay, I really want to kind of circle back to the boarding school, in terms of what's happening in Indian country and all the uncovered grave, you know, the grave, what's happening. I don't want people to believe that just because my experience was good, that it was good for everybody. And I also want to let you know that I did go to a Catholic school. I'm not trying to be early on. And it wasn't a very good experience for me, you know, as a young person. And so I do understand that. Right now, there's people are wanting answers. You know, they're wanting answers, and I want people to understand that not all experiences were good. There were many, including my grandfather who went to boarding school. It wasn't a very positive experience. So I just want to leave with that. So I want to validate people who haven't have family members that didn't have a good experience. That definitely is so for a lot of people.
Thank you for that. And they did get better over time. But yeah, early on, it could be a really horrific experience for people. And I would recommend the movie Indian Horse. It's about, have you seen it? Yeah, it's about in Canada, some students who were forced into boarding school. It's hard to watch. If you have any kind of sympathy or empathy for others, it's very hard to watch, but it does teach, you know, in a short time about some of the bad experiences. So our time is
You
up.
have a quote for that.
Okay.
Scars remind us where we've been, but they don't have to dictate where we're going.
I've heard that. It's a good quote. So thank you, ladies. Like I said, we have a week to ponder some of the questions in the chat. Like, go ahead and take a look. This is being recorded, so I can share those with you if you like. And then a couple more questions I had on my list. So we'll address those next week. I hope everybody will join us again, and hopefully you'll be able to do that live on September 21st at 5 o'clock Arizona time. And you know, submit some of your questions in the chat at that time. So for now, thank you, ladies, and we'll see you in a week.
Okay,
Thank you.
you.
Thank you.